Are you curious about tacrolimus and its role in organ transplantation? Look no further. In this video, we will delve into the mechanism of action behind tacrolimus and explore why it is commonly used in organ transplantation. Organ transplantation is a life-saving procedure, but it comes with the risk of rejection. This is where tacrolimus, a potent immunosuppressive drug, plays a crucial role. By inhibiting the activation of T-lymphocytes, it helps to prevent the immune system from attacking the transplanted organ. The mechanism of action of tacrolimus involves binding to a specific protein called FK binding protein 12.6, which then inhibits calcineurin. This inhibition disrupts the production of cytokines, which are responsible for the immune response. Used in both adults and children, tacrolimus has shown remarkable success in improving graft survival rates and reducing the risk of rejection compared to other immunosuppressants. Stay tuned as we explore the common uses of tacrolimus in organ transplantation and shed light on its safety profile and potential side effects. Harnessing the power of tacrolimus, medical professionals can ensure better outcomes for patients undergoing organ transplantation. Mechanism of action of tacrolimus. Tacrolimus, also known as FK506, belongs to a class of drugs called calcineurin inhibitors. Its mechanism of action involves binding to a specific protein called FK binding protein 12.6, FKBP 12.6. This binding results in the formation of a complex that inhibits the activity of calcineurin, a key enzyme in the signaling pathway of T lymphocytes. Calcineurin plays a crucial role in the activation of T lymphocytes by dephosphorylating a transcription factor called nuclear factor of activated T cells, NFAT. NFAT then translocates to the nucleus and initiates the transcription of various genes involved in the immune response, including the production of cytokines. By inhibiting calcineurin, tacrolimus prevents the dephosphorylation of NFAT and thereby disrupts the production of cytokines. This inhibition of cytokine production dampens the immune response, reducing the risk of rejection in organ transplantation. Furthermore, tacrolimus has been shown to inhibit the production of interleukin-2, Illinois-2, a key cytokine involved in T lymphocyte proliferation. This additional mechanism further suppresses the immune response and enhances the success of organ transplantation. In summary, tacrolimus exerts its immunosuppressive effects by inhibiting calcineurin and disrupting the production of cytokines, thereby preventing the activation and proliferation of T lymphocytes. The role of tacrolimus in organ transplantation. Organ transplantation is a complex procedure that involves the transplantation of a healthy organ from a donor into a recipient. While organ transplantation can save lives, the transplanted organ is at risk of being rejected by the recipient's immune system. The immune system recognizes the transplanted organ as foreign and mounts an immune response to destroy it. This immune response involves the activation and proliferation of T lymphocytes, which release cytokines that recruit immune cells to attack the transplanted organ. To prevent rejection and ensure the success of organ transplantation, immunosuppressive drugs, such as tacrolimus, are used. Tacrolimus plays a key role in suppressing the immune response by inhibiting the activation and proliferation of T lymphocytes. By blocking the production of cytokines, tacrolimus disrupts the immune cascade that leads to rejection. This allows the transplanted organ to adapt and integrate into the recipient's body without being attacked by the immune system. Tacrolimus is commonly used in organ transplantation due to its potency and effectiveness in preventing rejection. Its use has significantly improved graft survival rates and long-term outcomes for transplant recipients. Common uses of tacrolimus in transplant medicine. Tacrolimus is widely used in various types of organ transplantation, including kidney, liver, heart, lung, and pancreas transplants. Its efficacy and safety profile make it a preferred choice among medical professionals. In kidney transplantation, tacrolimus is commonly used as part of an immunosuppressive regimen that also includes other drugs, such as corticosteroids and mycophenolate mofetil. This combination therapy helps to prevent rejection and improve graft survival rates. In liver transplantation, tacrolimus is often used in combination with other immunosuppressive drugs to prevent rejection and maintain liver function. Its use has been shown to reduce the risk of early graft dysfunction and improve patient outcomes. For heart and lung transplantation, tacrolimus is an essential component of the immunosuppressive regimen. It helps to prevent rejection and maintain the function of the transplanted organ, ultimately improving the quality of life for transplant recipients. In pancreas transplantation, tacrolimus is used to prevent rejection and maintain insulin independence in patients with type 1 diabetes. Its immunosuppressive properties help to preserve the function of the transplanted pancreas and improve glycemic control. Overall, tacrolimus is a versatile and effective immunosuppressive drug that plays a critical role in preventing rejection and improving graft survival rates in various types of organ transplantation. Benefits and challenges of tacrolimus in transplantation. The use of tacrolimus in organ transplantation offers several benefits, but it also comes with certain challenges that need to be managed. One of the main benefits of tacrolimus is its high efficacy in preventing rejection. Studies have shown that tacrolimus-based immunosuppressive regimens result in lower rejection rates and improved graft survival compared to other immunosuppressants. This translates into better long-term outcomes for transplant recipients. Tacrolimus also has a relatively fast onset of action, allowing for early intervention and prevention of rejection. Its potency in inhibiting T-lymphocyte activation and cytokine production makes it an effective immunosuppressive agent. Another advantage of tacrolimus is its ability to be used in both adults and children. This flexibility allows for consistent immunosuppression across different age groups, ensuring better outcomes for all transplant recipients. However, the use of tacrolimus in transplantation is not without challenges. One of the main challenges is the potential for nephrotoxicity, especially at higher doses. Tacrolimus can cause kidney damage, leading to impaired renal function. Close monitoring of renal function and dosage adjustments are necessary to minimize nephrotoxicity. Tacrolimus is also known to have a narrow therapeutic range, meaning that the dosage needs to be carefully adjusted to achieve optimal immunosuppression while minimizing the risk of toxicity. Regular monitoring of tacrolimus blood levels is crucial to ensure that the drug is within the therapeutic range. Furthermore, tacrolimus can interact with other medications, potentially leading to drug interactions and altered drug metabolism. This highlights the importance of medication reconciliation and close monitoring of drug interactions in transplant patients. Despite these challenges, the benefits of tacrolimus in preventing rejection and improving graft survival rates outweigh the risks when used appropriately and with careful monitoring. Dosage and administration of tacrolimus. The dosage and administration of tacrolimus in organ transplantation are tailored to each individual patient based on factors such as the type of transplant, recipient characteristics, and potential drug interactions. Tacrolimus is available in oral and intravenous formulations, with the oral form being the most commonly used. The dosage is typically initiated shortly before or immediately after transplantation and is adjusted based on tacrolimus blood levels, renal function, and other clinical factors. The target tacrolimus blood levels vary depending on the type of organ transplantation and the time since transplantation. Generally, lower blood levels are targeted in the early post-transplant period to minimize the risk of toxicity, while higher levels may be needed in the long term to maintain immunosuppression. Regular monitoring of tacrolimus blood levels is essential to ensure that the drug is within the therapeutic range. Blood levels are typically measured using immunoassays or high-performance liquid chromatography (HPLC) methods. Dose adjustments are made based on the tacrolimus blood levels, aiming to achieve the desired therapeutic range. These adjustments may be necessary due to changes in renal function, drug interactions, or other factors that can affect the pharmacokinetics of tacrolimus. The dosage and administration of tacrolimus require close collaboration between the transplant team, pharmacists, and the patient to ensure optimal immunosuppression and minimize the risk of toxicity. Potential side effects and drug interactions of tacrolimus. While tacrolimus is a highly effective immunosuppressive drug, it can also cause certain side effects and interact with other medications. Awareness of these potential side effects and drug interactions is crucial for the safe and effective use of tacrolimus in transplantation. One of the most significant side effects of tacrolimus is nephrotoxicity. The drug can cause kidney damage, leading to impaired renal function. Regular monitoring of renal function is necessary to detect any signs of nephrotoxicity early on. Other common side effects of tacrolimus include tremor, headache, gastrointestinal disturbances, and increased blood pressure. These side effects are usually dose-dependent and can be managed by adjusting the dosage or using supportive therapies. Tacrolimus can also increase the risk of infections due to its immunosuppressive effects. Transplant recipients on tacrolimus should be closely monitored for any signs of infection and receive appropriate prophylactic therapies. Drug interactions are another important consideration when using tacrolimus. Tacrolimus is primarily metabolized by the cytochrome P453A4 enzyme system and can interact with drugs that induce or inhibit this enzyme system. These interactions can lead to altered tacrolimus blood levels and potentially affect immunosuppression or increase the risk of toxicity. Common medications that can interact with tacrolimus include azole antifungals, macrolide antibiotics, calcium channel blockers, and certain anticonvulsants. Close monitoring of tacrolimus blood levels and appropriate dosage adjustments are necessary when using these medications concomitantly. In summary, tacrolimus can cause side effects such as nephrotoxicity and increase the risk of infections. It can also interact with other medications, highlighting the importance of close monitoring and medication reconciliation in transplant patients. Monitoring tacrolimus levels in transplant patients. The therapeutic monitoring of tacrolimus blood levels is essential to ensure optimal immunosuppression while minimizing the risk of toxicity in transplant patients. Tacrolimus has a narrow therapeutic range, meaning that the dosage needs to be carefully adjusted to achieve the desired immunosuppressive effect without causing toxicity. Monitoring tacrolimus blood levels allows for individualized dosage adjustments based on the patient's response to the drug. The target tacrolimus blood levels vary depending on the type of organ transplantation and the time since transplantation. In the early post-transplant period, lower blood levels are targeted to minimize the risk of toxicity. As time progresses, higher blood levels may be necessary to maintain immunosuppression and prevent rejection. Regular monitoring of tacrolimus blood levels is typically performed using immunoassays or high-performance liquid chromatography (HPLC) methods. These tests measure the concentration of tacrolimus in the blood and provide an indication of the drug's therapeutic range. The frequency of monitoring tacrolimus blood levels depends on various factors, including the time since transplantation, the stability of the patient's condition, and the presence of any dose adjustments or drug interactions. In the early post-transplant period, more frequent monitoring may be necessary to ensure optimal immunosuppression and dosage adjustments. In addition to tacrolimus blood levels, other clinical parameters, such as renal function, liver function, and the occurrence of adverse events, should also be monitored regularly. These parameters provide a comprehensive assessment of the patient's response to tacrolimus and help guide dosage adjustments. Close collaboration between the transplant team, pharmacists, and the patient is crucial in monitoring tacrolimus levels and ensuring appropriate dosage adjustments. Regular communication and education regarding the importance of therapeutic drug monitoring can empower the patient to actively participate in their care. New developments and future directions in tacrolimus research. Tacrolimus has been widely used in organ transplantation for several decades, but ongoing research aims to further enhance its efficacy and safety profile. One area of ongoing research is the development of new formulations of tacrolimus that can improve its pharmacokinetics and reduce inter- and intra-patient variability. These new formulations aim to provide more consistent drug levels and simplify the dosing regimen, ultimately improving patient outcomes. Another focus of research is the identification of biomarkers that can predict tacrolimus response and the risk of adverse events. By identifying biomarkers, medical professionals can personalize the dosage and minimize the risk of toxicity or rejection. Furthermore, research is ongoing to explore the potential use of tacrolimus in other conditions, such as autoimmune diseases and inflammatory disorders. The immunosuppressive properties of tacrolimus make it a promising candidate for these conditions, but further studies are needed to determine its effectiveness and safety. Additionally, efforts are being made to optimize tacrolimus dosing strategies based on pharmacogenomic data. Genetic variations in drug metabolizing enzymes and drug transporters can influence tacrolimus pharmacokinetics and response. Tailoring the dosage based on an individual's genetic profile may lead to improved outcomes and minimize the risk of adverse events. The future of tacrolimus research holds promise for further advancements in organ transplantation and immunosuppression, ultimately improving patient care and outcomes. Conclusion: the importance of tacrolimus in successful organ transplantation. Tacrolimus plays a vital role in the success of organ transplantation by preventing rejection and improving graft survival rates. Its mechanism of action involves inhibiting T-lymphocyte activation and cytokine production, thereby suppressing the immune response. Used in various types of organ transplantation, tacrolimus has shown remarkable efficacy in reducing rejection rates and improving long-term outcomes. However, its use requires careful monitoring of blood levels, renal function, and potential drug interactions to ensure optimal immunosuppression and minimize the risk of toxicity. Ongoing research aims to further enhance the efficacy and safety profile of tacrolimus, with a focus on new formulations, biomarkers, personalized dosing strategies, and exploration of its use in other conditions. Overall, Tacrolimus has revolutionized organ transplantation and continues to be an essential tool in the arsenal of medical professionals.